breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, the man with the plan, Dr. Glenn Harrison. What's up, bud?
Not much. This is kind of a fun topic. I think it is. I think the concept we're going to bring out is going to bring out emotions from both sides of the aisle.
Mm-hmm. Yeah, I would agree with that. I think that this is something that you and I talk about really, really frequently together, and something that puts a burr under my saddle.
To say the least.
Yeah. But it's something that I think that maybe both patients and providers need to be reminded of. And even ourselves on occasion, because it's not like we're not guilty of it either. And we've kind of titled this episode like, what is junk medicine and how do we stop dealing with it, right?
That's right.
If this is your first time listening or watching podcast or telecast, and you have questions on your own health or health related information that you'd like to find, make sure you hit like and subscribe, turn on notifications, because we're going to continue to break down new health topics or issues within the health community each and every week. Let out new episodes on Mondays at 5 p.m. time. So keep tuned. And I just lost my video.
Yeah, you're back now. You're back.
So, yeah, man, let's get started.
Okay.
What is junk medicine?
Oh, wow. Okay. Junk medicine.
Here it comes right down the pipe.
Yeah, junk medicine is exactly what it sounds like. It's really where the doctor either doesn't have the resources to properly do his or her job, or the patient isn't allowing the doctor to do his or her job. But I don't want to put this on the patient, because the doctor is ultimately the one who should be determining the path of care. And ultimately it leads into poor outcomes for the doctor and poor outcomes for the patient. And there's many causes to this. So that's, and junk medicine is not only, definitely, conventional allopathic medicine, but any form of medicine, any form of care could be junk care. I guess we could even change the term to it, but junk medicine sounds better. So, so what are some of the criteria of it that kind of creates that environment of junk medicine? Sure.
So when we were breaking this down, and we discussed this a couple of weeks ago, we kind of broke it down as condensed it as much as we could without like going off into the desert a little bit. But we basically, it's a limited or lacking approach to providing proper care, right? So what this means is it could mean reduced time with the patient. That could mean either face-to-face with the patient or interacting with the patient outside of their appointment. It could be limited amount of time prior to seeing the patient. So basically limited time to work up their case or research their case. That's one of the requirements in my office. If you're going to be seen, as I'm actually making it longer now, because people sometimes have a hard time getting it in. But I request that I have their new patient paperwork 3 days prior to their appointment, so I can actually go over their case and start forming a clinical thought process prior to even seeing them, so that when they come in, I can really, really hammer down, and I'm already familiar with their case, so that we can be really, really efficient, and I already have a knowledge going into it.
Exactly, versus trying to wing it, grabbing some note off the front desk about 30 years of patient history, where the patient wouldn't even have the time to put in the data, and then the doctor's going to try to run with it in the back room and come up with a plan in literally a minute to 3 minutes, maybe 5 minutes. That is a great example of junk medicine that is everywhere, absolutely everywhere. So there's many scenarios that kind of create this environment. But first off, naturally, some of the obvious ones, what are the consequences of this junk medicine?
Yeah, I think the biggest thing is that people don't get better. It seems like a very obvious thing, but if you're not receiving quality care, or you're not receiving care that's really, really tailored to what you have going on, and that can be anything. It doesn't even have to be, health related. It could be like going to a personal trainer, right? Oh, I want to get, I just want to do this. Okay, take this program and go with it, right? But you never meet with that trainer again. They don't know what your limitations are. They don't know. Yeah. and that's not how people are. Every person is an individual. Every individual has their own biochemical makeup, their own physiologic makeup, their own neurological makeup. So everyone is unique. So for us to think that we can take like a protocol or a program and just give it to everybody, now for some people that might work great, but for other people not so much. And when you don't have the time and you don't have the case familiarity and you're not able to work it up, then they're ultimately going to have diminished outcomes.
For sure. And then it's actually frustrating for both parties, the patient naturally. And then when these, because it's really cutting corners, whether the doctor's cutting corners or the doctor's being forced to cut corners, or the doctor gives in to another entity, maybe the patient, to cut corners, and I want to get in quickly, and I don't have time for this paperwork, and I just need to get better. The doctor says, okay, well, they've just literally cut their own throat, and then it destroyed the potential outcomes. And sometimes the situation is the result of an effort to cut costs. And cutting costs in with these, if the provider, if it limits the provider's tools, resources, effort, opportunity, well, then both parties lose again. So a lot of consequences to these. And I know you talked about this, and you were talking about if there's less depth per appointment, well, how many appointments are you going to need?
Mm-hmm.
And that's not cost effective,
Mm-hmm.
right? If you're steady, okay, that didn't work. Okay, well, we didn't look into that. Well, let's look into it deeper next time you come in. Let's look into it versus taking the whole picture and really, digging your heels in.
And it might seem like it takes more time, but in all actuality, it's probably more efficient because you're getting more done during that time. I've actually had this with patients where I had a patient a couple of weeks ago actually that didn't get their paperwork in a timely manner when he was supposed to. They came in, and when I met with them, I literally just had to say, I don't have time to even start an exam on this because the paperwork you brought me is this thick. Like, it's not going to do any due diligence for you it's not going to do you any good or me any good for me to beat my head against the wall trying to get this all read in 25 minutes and to give you like a semi-formulated thought. So we actually scheduled another thing, and that's just the new patient exam. Then you come in for re-exams or treatment or whatever. If you're able to do what you think you need to do to actually get that patient better, whether that's talking about dietary changes or the application of therapies or whatever, and you actually have that time set aside, and both patient and provider know what's going on, and they're able to apply all that stuff in that appointment, then it's going to be more time efficient than if it's like, come in for 15 minutes, we'll talk about it real briefly, go try this at home.
That's so true. That would
come back in a week. Oh, that didn't work. Okay, we're going to try this. Go home, try this at home.
And what would we call that?
Yeah, junk medicine.
after we were brainstorming this topic, and I think I shared this with you, it was fresh in my head, and I was doing things in clinic, and people were, there's pressures. I need to get in today, or no, I never had a chance to take my paperwork. And I'm like, don't go into junk medicine, because you might make someone happy for a minute. You're going to upset them for months.
Mm-hmm.
And these cases are hard enough without junk medicine. Never mind adding that variable in. But the other consequence other than costs, but what are the health consequences of not getting the outcome? That's another thing, progression of disease.
Right. Well, and even I think of it this way, right? So say you have a patient that comes in, you're not familiar with their case, they come in, you're rushing through it, and you miss something that should be a big blinking red light. Or even, we'll say it's a yellow light, right? So it's not blinking frivolously at you, but it's sitting there and you're like, ooh, this could be something that could potentially move into something more significant, but you miss it because you're in a rush, because you aren't familiar with the case, because you didn't have time to work it up. And then that turns into something more significant. So you have a patient that comes in with fatigue and blah, 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 blah. And then all of a sudden they go from pre-diabetic to full blown diabetic. And then they have issues with their eyes or their kidneys or whatever. How is that cost effective?
That's right.
Because you just moved from something that you could have helped them manage maybe a lot easier into all of a sudden you have more expensive medical interventions that maybe they didn't need to have because it was missed. And no one's it could be either party's fault, the patient for being unrealistic with what they are expecting of the doctor, or the doctor for not setting clear boundaries and having enough time to actually break down a case the way they need to.
Yeah, you kind of hit on the next piece that I was going to bring up. Like, what causes junk medicine? Well, like you said, doctors trying too hard to meet unrealistic expectations of patients' expectations.
Well, it doesn't even just have to be the patients. I mean, it could be their employers too.
That's right.
We look at, you have to see this many patients per day in order to maintain your employment.
Volume-based model like we see in conventional medicine in the Western world. It's all volume-based. It's not outcome-based. It doesn't matter what procedures, and I shouldn't just say that. There's a lot of natural medicine clinics that are volume-based as well. So yeah, a lot of factors that play into this, and if the doctor is not going about it the right way, they will try to cut corners due to emotions. Trying to cut corners, oh, well, I know this person, I really want to help them out. I think we only need this much time versus we should have a larger amount of time. I think we'll try to do it there. And you made this point when we were talking about this emotional decision making versus factual of what needs to be done. And naturally, who loses? They're trying to do it with
the patient. Both people lose, but the patient loses because they don't get the outcome.
For sure. And then one of the big thing we hit on a lot about causes or contributors to junk medicine is time constraints. Doctors aren't realistic of how much time is required into a case based off the volume model, which I believe is a major cause to many missed disorders and progressions of different disorders and diseases here in North America. So those are more internal factors that that when the doctor is at fault, if we want to say the doctor's at fault. But there's some external factors, maybe you want to elaborate on those that aren't the doctor's fault, that are out of the doctor's hands.
Sure. I think that, so like you talked about, the doctor has the ability, it's got to be boundaries, right? And it's got to be boundaries that are respected and observed by both parties, both the patient and the doctor. And the doctor is ultimately the one that needs to be consistent with it. But when you look at things that are beyond their control, then you look at things like, being reimbursed by insurance companies. Like, is it going to be ultimately practices or businesses, and the doctor or the provider or the practice, we'll say, has to be able to make money in order to stay open. Well, is this specific service going to be reimbursed by insurance? And if so, what's the reimbursement rate? If you're going to spend an hour with a patient and you're going to make, the clinic can bill out $18, then it's probably not necessarily a good recipe for longevity for that clinic. So that's one of the factors that you would consider contributing to junk medicine, where if the reimbursement rates are really, really poor, or they're not going to cover specific services, then maybe the provider is either A, not going to do them, or B, he doesn't give them the time that maybe the patient actually needs in order to get the most therapeutic benefit out of it. We look at some of the other things as, like we talked about, if you're an employee for another, for a hospital or a practice or whatever, and it's an incentive-based model where it's like the amount of volume that you see is basically equal to your compensation. So the more you see, the more you make. And there's actually certain practices or businesses that is like, you will see a patient every X amount of minutes. And if you go over, then you're in trouble, or you get, penalized.
That's exactly right. Just not to interrupt too much, but there was a friend of mine. He was a neurosurgeon out of Florida, and he was a retired neurosurgeon. He's actually got in the field of functional medicine. And I asked him, I said, well, what was the shift? And he said it was time. And I said, well, tell me about this. And he said pre-op consult, before he's, when he meets with the patient and probably the patient's family, explaining about the procedure, opening up the skull or the spine, because that's his world. And he was allowed, as a pre-op consult, he was allowed 15 minutes with his patient. That's it. That's an introduction. Okay, we're going to do X, Y, Z. This is how much time. And that was it. And he was going over 20 minutes, 25 minutes, 30 minutes. And he was going over, but he was about to retire. So at the end of the week, they would always say, Doc, how can we bring up your productivity? And that blew my mind. And he said, yeah, that was their cap, 15 minutes, but now they're shifting it to 10 minutes. Well, we'd like some peace of mind as a patient. So that was out of his hands. He ended up leaving, but definitely not everybody could leave. So yeah, that's what I had to say about that.
It's a good example, and it happens all over the place, and it doesn't just happen. I mean, it literally happens all over. So
that's right.
Something that we're both really passionate about because it drives me crazy.
And it's difficult. I know you and I talked about this. It's difficult to avoid it because that's that emotional component setting. And well, maybe I can do this, or maybe I can fit them in, or maybe we didn't need to do all of this. And we're being challenged. The patients are inquiring, but if we bend all the time and they don't have the outcomes, well, nobody wins. It's just a major loss, and it could be extremely dangerous in some cases these are lost. So how do people avoid junk medicine? What are some strategies?
So as a provider, because I think both you and I have gone through this, is you just have to be very, very clear with your boundaries, and you have to respect the boundaries. Once you set them, you've got to keep and it's hard because you and I both deal with it. You want to help people. You want to make it as affordable as possible. You want to get them the highest quality of care. Sometimes you just have got to pony up. You have to schedule the time, whether it's a time commitment or a monetary commitment, whatever it is, you just have got to do it. And you have to stay consistent and observe the boundaries that you've set in place. So as a provider, that's a big one for us. I think as a patient, when you look at stuff that you can do to avoid, or maybe find the provider that's best suited for you, research them, right? So that we got this wonderful tool called Google, and you can look at all their reviews online. You can look at their outcomes. You can look at you can decide what your expectations are prior to seeking out a provider, right? Whether that's, how much it's going to cost or what that provider's outcomes are. Because sometimes they're directly proportional, right? The price goes up and so are the outcomes. And that's just because they're being, they know what it's going to take and they charge what they think it's going to cost.
That's exactly right. So I think it's kind of the responsibility of both parties. If you are going to look for the cheapest, quickest fix, it might feel good, and you might even get a provider to say, yeah, I can do it for that. Oh my goodness. Be careful. Be very, very careful. Or recognize the shortcuts do have consequences. And if you're okay with those consequences, whatever those are, well, but just be aware of it, because it's kind of like if people are buying insurance and someone is always able to undercut the other insurance. Well, what are they cutting out of
out of the policy?
Yeah, what are they cutting out of the policy? Usually there's going to be something.
Oh, you don't need glass.
Yeah. And then another thing is you were talking about, how does a provider, and this is closer to us, I guess, how does a provider avoid practicing junk medicine? Well, the realm they're in, of course, or the insurance or the cash, and what are their time constraints? What can they do? And then how firm can they be with the request of, maybe patients trying to cut the corners? And then being completely honest, how much time does it take with these people? How much is your outcomes going to be compromised if you can't communicate? And then the next thing is, how many family members are going to be knocking down your door, friends? Oh, I just need a little bit of advice, or I just need this quick lab test. And I'm smiling right now because I know Dr. you and I get that all the time. And I made my mistakes. I made mistakes. We had a friend and she's like, oh, we'll just run some lab work. I'm like, okay, but if we run lab work, we're going to find problems. And then you're going to want solutions. Oh, no, just lab work. So ran lab work. I'm like, lots of problems. So, oh, well, what do I do
about that?
What do I do? Because it's always a follow-up question, naturally. I'm like, well,
what you do is schedule the
kind of do this, or well, I can kind of do that. And I didn't even order all the lab work I should have to the start, because I wanted to try to save them money. More so because it was practically like family. And ultimately what happened is this individual needed to go for more and more and more and more lab work in multiple steps, because I should have did it all right at the start.
And you probably didn't do as thorough a history as you should have. Oh, I got this problem. Can you order this? Yeah, sure.
Of course.
And you send it off and you didn't research it. You didn't break it down. You didn't investigate it. And you're like, how did I miss it?
Exactly. And I look back and say, oh my goodness,
You didn't even give yourself a chance.
Years later, no, there wasn't even the opportunity to be successful. And, I learned that a few years ago. And, I had another inquiry with another friend, and he asked the same thing. Oh, can I order some blood work? And I'm like, nope. But I know some great doctors who can.
Yep.
What do you mean, Dr. Harrison? Why can't you help me out? I said, well, I'm not going to be able to be, I'm going to miss something.
Right. I think that actually is a good point, is like, as a provider, you need to realize what allows you to do your absolute best work. Whether that's from a time constraint, like, this is what I need to do my best work with these type of patients. This is how much time I need at follow-up visits. This is what I need, and putting yourself and the patient in the best position to succeed, right? Because both you and I have had outcomes that were less than desirable, where we cut corners or whatever, and it doesn't feel good for us either.
No.
Because you're frustrated. You just want to get people better, and they're not getting better. So you need to figure out what you need in order to do your best work.
Exactly. And in summary, I guess if we're gonna finally summarize this, I think in the world of junk medicine, because there's a lot out there, it's everywhere, and I think there's more and more and more of it. As insurance companies are cutting corners, having limited, giving the doctors limited resources, the doctors trying to cut corners because they're some of them. Now, I'm just saying some. These are red flags. They're based off a volume-based model, so there's going to be corners cut. The lowest bidder. So if you're shopping around for doctors, say, I can do it for cheaper. I've had many people come to my clinic, and it's a cash practice. So insurance doesn't cover what we do. So they shop around, which is important because they should find the personality that's going to be right for them. And sometimes I've seen, oh, Dr. Harrison, I couldn't work with you because I found something quite a bit cheaper. And I'm like, whoa, well, hopefully it's more than just cheap.
Yep.
And then many times they come back because it didn't work out, and there was a whole bunch of dollars and time and heartache wasted, and it breaks my heart. So what do I want to do? Well, maybe we can cut corners. I'm like, no, don't do that. Don't do
it to yourself.
Yeah.
And them.
So as a provider, we have to be careful of all these things, because there's going to be pressures every day. And as the patient, recognize that junk medicine exists. And I think that's the biggest thing. Do your homework, do your research, make sure it's the right fit for you. And the lowest bidder is, there's got to be something. There's going to be something that's deficient. So be aware of that. I think those are the biggest things. Yeah.
Absolutely. So if you got value out of this podcast telecast today, obviously, like we talked about earlier, hit like and subscribe, turn on notifications, because we're going to continue to break down issues in the healthcare system or common health concerns that people have every week. If you have questions for us, you can always get a hold of us. Our email is info@brainstormingwiththedocs.com. You can get a lot of information on our websites. Mine is www.northlakeschiropractic.com. Dr. Glenn has got a whole plethora of videos on his website, and his is www.drgharrison.com. Or drop a question or comment in down below.
Yeah,
so
sure.
We'll get back to you.
That's awesome, Dr. Kolby. So watch out for that junk medicine.
All right, buddy. Yeah, stay the course. All right.
All right. We'll talk later.
All right. Bye.